Hi, I'm Angela Morton. I'm the Consortium Director with the Recovery is Community NWPA grant project through the Rural Communities Opioid Response Program. I'm here today with Dr. Mandy Fauble, Director of Clinical Care Services at UPMC Western Behavioral Health at Safe Harbor. And today we're joined for our next segment of the Recovery Is series on learning more about substance use issues and increasing access to treatment resources and prevention education and recovery supports for people struggling with substance use. So thanks for joining us for our next segment of Recovery Is. We're here today with two really great nurses that we work with. I'm going to let Kaleigh and Cheri introduce themselves. Hi, Kaleigh.
Hi, I'm Kaleigh Gustafson. I'm a registered nurse and mobile case manager for the Women's Recovery Center in Franklin through Western Behavioral Health at Safe Harbor, along with Mandy, and work really closely with Cheri and Angela on this project, helping women and babies. So,
thanks, Kaleigh. How about Mandy?
I'm Dr. Mandy Fauble, and I am the project director for the grant that Angela is talking about, and also the project director for a grant that helps to reduce neonatal abstinence syndrome, which is something that we're going to talk about today, or neonatal opioid withdrawal syndrome. Sometimes we talk about it that way. But nonetheless, one of our big goals is to reduce the impact of substances on small children and their families. And so I'm going to turn it over to Cheri Siverling, because there's no one I can think of who's doing more up close and personal work in that space. So Cheri, tell us about yourself.
Hi, everyone. I'm Cheri Siverling. I'm the unit director of the Birthing Center at UPMC Northwest, and I am here to tell you in 5 or 10 minutes about what we do with the babies that are affected by neonatal abstinence, or NOWS, which is NOWS. Neonatal abstinence is just a general term that's used for babies that are affected by substances that the mom takes. Can be alcohol, tobacco, can be some sort of antidepressant medication. The newer term now for the syndrome that we're going to talk about is a neonatal opioid withdrawal syndrome, and that's babies that are affected by moms who are in treatment for some sort of opioid use disorder, or moms who are struggling with opioid use disorder currently. What we do with those moms and babies for treatment-wise is a new process that we use here at Northwest called Eat, Sleep, Console. It was developed just a few years ago by a Matthew Grossman out of Yale University, and it is an innovative way to deal with these babies, finding out whether they can eat or if they can't eat well because of their withdrawal, finding out how long they sleep, or if they're unable to sleep because of the withdrawal symptoms that they're experiencing, and are they able to be consoled. This is a current problem in northwestern Pennsylvania, and from some of my research, I found that there's a baby born every 15 minutes that will need to be observed for signs of withdrawal. So it's a very current issue right now that we're dealing with. Let me say, along with Kaleigh, we work closely with Kaleigh, and we also work closely with the county resources from Venango County to take care of these babies. And we have gotten a grant from the PAPQC, or the Pennsylvania Perinatal Quality Collaborative, to make 2 of the rooms on our unit more comfortable for these moms. We like the moms to stay the whole time the baby's in the hospital. Mom is discharged usually on the 2nd day. Babies stay 5 to 7 days for signs of withdrawal. And we wanted to make those rooms more comfortable for the moms so they're able to stay here. We've outfitted the rooms with better lighting, lower lighting, noise machines. We have a little table and chairs And we have included a safe so mom can keep her medications in a safe and here. And it has a little refrigerator in the room so mom can have her snacks there. And if she's breastfeeding, she can keep her milk, any milk that she pumps in that refrigerator in her room. So that's been beneficial to us, gives the moms a more comfortable place to be while they're here. This is Kaleigh's playing an integral part in bringing those moms in ahead of delivery, educating them on the need for them to stay for those 5 to 7 days. The huge overarching goal of Eat, Sleep, Console is for the mom to be the primary treatment for the baby. The way we used to take care of these babies, they were taken to the NICU and treated by the nurses, and the moms visited them in the neonatal intensive care unit. But the way we do it now, mom stays, she's the primary caregiver. We teach the moms how to give non-medication care to the baby. We don't want to treat the baby's withdrawal with medication if we don't have to. We teach the mom how to put the baby skin to skin, how to rock the baby, how to swaddle the baby, how to cuddle the baby, singing, humming, dark room, low lighting, low stimulation for the baby. And that's the primary goal, is to get mom to learn how to care for that baby so she can take that baby home and keep that baby consoled and comfortable.
So thank you, Cheri. You're doing amazing work there at the hospital at your at the Family Birthing Center. And I wanted to ask, all of that you do for moms and for the babies. I know that what we've learned is that outcomes for babies are better when we take care of moms. So can you maybe just say a little bit about the success of that? All that work you do, how does it do for the babies? What does it do for the babies and the moms?
We have had a tremendous drop in the amount of babies that we've had to treat medically or with medication for their withdrawal. We have only had to medicate one baby in 2021. So since that switch to the Eat, Sleep, Console, our treatment rate with medication has dropped.
That's great. Thank you. It's so good to know that there's something we can do to help
Yes.
the moms who are struggling and subsequently help babies, and the impact of just substance use on families in general. That's something that we talk a lot about. And maybe, Kaleigh, that's a good segue for you to talk a little bit about substance use and how it impacts families and the work that you do with women.
Yeah, so I, like Cheri said, work closely with what they're doing at the hospital, and I'm familiar in my clinical experience as a nurse. I worked with Cheri at the hospital for a long time before I made my way here. So, it's a really important piece, but getting the ball rolling, so to speak, and that education piece for moms and the support for the mom and the family throughout her entire pregnancy is a really, it's a game changer, to really prepare them for what that's going to look like. It's a scary thing to know that you may end up being in the hospital a little longer with your baby and not really know what that's going to look like. And to walk into ready to have your baby at such a vulnerable time and not be prepared for that is scary. So I really work with the moms, not only to help treat the substance use disorder through our program here, but really just support them as a whole, so that that they know what to expect and can prepare themselves to be there and to work with Eat, Sleep, Console at the hospital, and then also following up after they go home. It's a scary time with a new baby, let alone a new baby that could be experiencing some of those withdrawal symptoms, and the overwhelm that comes with all of that, especially if you have a family at home too. So it's kind of all of Cheri does that piece. I kind of help surround the before and after as well.
So Mandy, do you have any questions? We have lots of things to talk about when it comes to babies and moms and the work that we do.
Yeah, I mean, I have a question and a comment. I think that one of the most important things for people watching to learn is that babies that are born exposed to substances actually more often than not do very well. And so we sometimes can put ourselves in a negative space by thinking that babies aren't going to do well and they're going to need all kinds of services and supports, or that moms aren't going to do well. It's actually quite the contrary. What we know from a lot of research is that if we help people with the right things, something like Eat, Sleep, Console, and we help people with the right things, like the Women's Recovery Center, that actually women and families have great outcomes. And for a lot of women, what they tell us is that having a baby and having children is one of the things that most supports their path towards recovery, because they're so much more motivated to take care of children. So I think, Kaleigh, what would be really neat is if you would talk a little bit about, you talked about supports for moms and supports for babies, but like what types of things happen for women in your program?
So it's actually really cool, because I am actually co-located the Women's Recovery Center here at the OBGYN office in Franklin. So I do tend to like see women at all different aspects of their pregnancy. And so it kind of can look different for each of them, as it, care would for anybody. But there's a lot of great resources here in Venango County, like through the Human Services Department, that a lot of women may never have known existed. So part of what I do is not only kind of tying that OB prenatal care and the Women's Recovery Center with their treatment for their substance use or opioid use disorder, but also linking them to those resources that are already there. If they're struggling with housing, if they're struggling with transportation, job, medical insurance, anything. The county has a huge pool of all of these programs that without having a link to them, they may never know existed. So it is kind of a really, I'm in kind of like a really unique place to be able to like work within the OBGYN practice, work with Cheri, and work with the community resources that are already there and linking the women to all of those.
Yeah, it sounds like really an opportunity to give people a lot of resources, and then also to help cut down on confusion, because any of us that have ever had a baby, that's already pretty overwhelming. So coordinating all of those services and kind of helping someone organize that seems really helpful. Kaleigh, as you were talking, and Cheri, even as you were talking, I was thinking about the number of people that I've met that sometimes, their view about women who have babies when they're dealing with substance use disorder can be pretty negative. I've heard things like people should go to jail. They shouldn't be allowed to keep their kids. When we start talking about medications for opioid use disorder, I hear things like, oh, you're just swapping one drug for another. And so it's perpetuating addiction, or what other like negative labels. And so I want to hear from you guys on your opinions about medication for opioid use disorder, and also the facts, like what you've seen work. But I also think it's really important to share, will you work with women and babies who've been impacted by substance use disorder, and kind of what that's opened your heart and mind to in terms of why you're doing the work that you're doing?
I can speak to that. I will tell you that me going into this process of this grant program and everything, I have learned so much about addiction and the changes in the brain and so many different things that my personal opinion has changed. I realize that these women, need medication assisted treatment, because if they didn't have that, they would be taking drugs off the street, and who knows what's in those. And it is much better for the baby, for the mom, to be in a medication assisted treatment program, and we know what that baby's going to experience, and that baby might not experience anything. And the amount of withdrawal that the baby experiences is not really dependent at all upon the amount of medication the mom needs to take throughout the day. So yes, it is paramount to getting a good mom and a good baby for that mom to be in some sort of medication assisted treatment program.
And I'll just speak to what you said, Mandy, about pregnancy and motherhood and having a baby being a really motivating time for women. It is. I mean, and I think in my time that I spent as an OB nurse at the hospital, seeing that and experiencing what those women would go through just in that short time, their ultimate goal is to have a healthy baby. None of them want to, live the life that they may be living or had lived. They want to be successful. And the studies show that the success is there with medication assisted treatment and combined with drug and alcohol treatment therapy. And that's what we do here. But the success is real. I think people just have to open their eyes to see it. And I think if you give yourself 5 minutes with a mom who's experienced that, it's enough to really enlighten you.
So I was going to say thank you a little bit earlier. I wanted to say thanks for explaining the kind of the non-treatment end of things. The treatment needs, but also some of the outskirts, the non-treatment needs that sometimes can just be really overwhelming, whether it's childcare to get yourself to treatment, or transportation, or food insecurity, or housing concerns, healthcare, insurance, so that you can help get people connected to those resources at the County Human Services. And also, I just really appreciate when I hear both of you talk about the compassion that you show to the women and the families that you're working with, because what we know about substance use disorders is that they are a medical condition. It's a medical condition like any other condition, and the outcomes when we treat people with a medical condition with that same kind of compassion that any other medical condition they have, that the outcomes are better. They're better for mom and they're better for baby. So across the board, when we're talking about somebody who's struggling with substance use, as you mentioned, Cheri, the changes that happen in a person's brain when they use a substance, and that change then requires some kind of intervention, and everybody is maybe at a different level of what kind of intervention they want, but you happen to be on the front lines where women and babies are coming to you for help. So we really appreciate anybody who can help us get the word out there that these services exist, to reduce stigma about addiction, about substance use, to help people feel courageous to ask for help. If you're struggling, or you know someone who's struggling, to speak to them from a compassionate place is more likely to get them help, or to encourage them to get help, than they're already looking down at themselves and sometimes society and family and partners and friends. So when you talk to people in recovery, they'll say, nobody is judging me more than I'm judging myself with what I'm struggling with. So if we can bring some compassion and talk to people with an understanding of the disease of addiction, the brain changes, then I just always want to weave that in, because then we're breaking down the stigma. A person can then reach out and ask for help. So on that note, I always like to point out that you can call your county, single county authority for drug and alcohol treatment services. So if you call your local county human services phone number and ask for drug and alcohol services, they will refer you. You can also call the national helpline for mental health and substance use. And that number is 1-800-662-HELP, the letters HELP, 1-800-662-HELP. And again, thank you both for being here, and thanks, Mandy, for bringing some of your expertise. And does anybody else have any final words to say?
Well, I definitely want to jump in by making sure that we help people understand that there's a big link between substance use disorder and unintended pregnancy. So we have to remember that these issues go hand in hand of unintended pregnancy, exposure to infants in utero, exposure to drugs and alcohol sometimes. We need to do more to have this conversation with women of childbearing age. And I also want to make sure that we touch on the fact that so many women don't get help because they're afraid their children will be taken from them. I want to make sure that people know that that's a myth. And so maybe Cheri and Kaleigh, you could just touch on that really briefly, because that's one of the dangerous things that keeps people from getting help, right?
Yeah, I was thinking of that when Angela was mentioning. Any last thoughts was that part of the reason that a women's recovery center is so important, and we're so thankful to be here, is that pregnancy and substance use disorders and unintended pregnancy, like you said, Mandy, really do go hand in hand. And a woman who may be struggling with a substance use disorder that finds out that she's pregnant might avoid her prenatal care. And the same goes for a woman who maybe is in a substance use treatment program and finds out she's pregnant, maybe really just decide she wants to stop her treatment, and that's not safe either. There's a lot of really poor pregnancy outcomes that can happen from that. And so I think the education piece and just supporting those two things together really is a big impact for outcomes too.
I think we've covered a lot of really important material, and I appreciate all of you being here. And I just want to say thank you again for joining us for the next segment of Recovery Is.